Being handed a leaflet about prostate cancer may have saved Thomas's life. Reading it persuaded him to push to be tested for the disease, even though his GP was convinced he wasn't at risk.
The GP just looked at me and said, "You okay, Thomas? There's no problem." So the GP never flags up this. And for prostate cancer, it's on their back burner. It doesn't come up with most of the GPs.
Black men are twice as likely to get prostate cancer, and Thomas believes his father died from it, but his GP never questioned him about his family history.
I would have been more alert, and the awareness would have been there, and the intervention would have come in time. If I'd learned it from my parents, my dad, it would have helped.
Thankfully for Thomas, treatment has been effective. But in the UK, 1 in 8 men will get prostate cancer during their lifetime. That chance rises to 1 in 5 if a man's father or brother has been affected. Yet, although almost all GPs know about this, only 1 in 10 GPs always ask patients about their relatives' history of prostate cancer.
About half of them don't ask about family history just because they've got so many other things that they are needing to talk to men about when they come to the doctors. But we want them to prioritise prostate cancer because it's actually the most common cancer in men, and it's killing 1 man every 45 minutes.
Thomas has now passed on what he knows to his young son.
The awareness is what I want to bring to my son. That's the same should have come to me. If my dad had told me, I would have found out before it got to this stage.
Having a close relative with prostate cancer does increase a man's risk of getting it, a fact that both men and their GPs should be more aware of. Catherine Jones, 5 News.